Pacific Station.
From ABC News, I'm Daria Albingers. Pennsylvania State Police have confirmed a body has been found in the rubble of an elevated section of I-95 that collapsed over the weekend in Philadelphia. It was brought down by a tanker truck fire underneath the overpass.
The tractor and trailer was trying to navigate the curve, lost control of the vehicle, landed on its side, and ruptured the tank and ignited the fire.
That's Pennsylvania Transportation Secretary Mike Carroll. Demolition is expected to begin soon, and it could take days. Former President Trump is at his golf course in Florida. Tomorrow, he'll have a new legal team when he's arraigned in Miami federal court. ABC's Aaron Katersky is there.
The two attorneys who were handling it for him resigned just hours after the indictment dropped. And I think that may reflect the nature of those attorneys. Jim Trusty doesn't do this kind of work in federal criminal court. And here the thinking is Trump really needs someone who understands not only the procedures in federal court, but also how to handle classified documents. He'll also need a security clearance in order to view some of these documents.
Security has been ramped up around the courthouse. A jury in Oregon found Pacific Corp Energy responsible for the 2020 Labor Day wildfires, which killed 9 people and destroyed nearly 5,000 homes and businesses. Illinois throws the book at book bans.
Illinois was the first state in the nation to ratify the 13th Amendment abolishing slavery. We were the first state in the nation to ratify the 19th Amendment, guaranteeing women the right to vote. And in a few moments, Illinois will become the first state in the nation to officially ban book bans once and for all.
Governor J.B. Pritzker signing the nation's first law of that kind in a ceremony at Harold Washington Library in Chicago. You're listening to ABC News.
Have you Googled yourself lately? Are there negative posts from an ex-employee or from a former client? Maybe an outdated news article or sensitive personal information about your family? Search engines don't always get it right. For right or wrong, it's your reputation on the line. That's where Reputation Defender by Norton comes in. One of the most trusted names in online reputation repair, Reputation Defender has been fixing people's search results for over 15 years. Their cutting-edge approaches help you to wipe away unwanted information in your search results. They also promote the good stuff so that it rises to the top, helping you put your best foot forward. Your good name is too valuable to leave to the whims of a Google algorithm. Take control with Reputation Defender. You can start by getting your free reputation report card at reputationdefender.com or call 800-401-6681 to speak to an expert. That's 800-401-6681. Over 1,000 student athletes are in Washington, D.C. today for the first College Athletes Day at the White House. It celebrates men's and women's NCAA champion teams from the 2022-23 season. Vice President Harris welcoming the players from 47 teams representing 19 sports.
You are from all over our great country, and you are national champions.
The vice president pinch hitting for the president, who was undergoing a root canal today. Garth Brooks facing a little backlash over a popular brand of beer. Here's ABC's Jason Nathanson.
Garth Brooks may be losing some friends while gaining new ones. He pledged last week in an interview with Billboard that his new bar in downtown Nashville will be serving Bud Light, amid a boycott by some conservatives after Bud Light teamed up on a promotion with transgender social media star Dylan Mulvaney. John Rich and Kid Rock have both taken Bud Light out of their Nashville bars. Brooks has supported the brand, as many on social media targeting him, saying they've burned his CDs and deleted his songs from their playlists. Brooks' bar is expected to open this summer. Jason Nathanson, ABC News, Hollywood.
16 young people are seeking to hold the state of Montana accountable for fossil fuel-friendly policies, which they say have exacerbated global warming and dimmed their futures. Lawyers for the plaintiffs will argue the state's ongoing support for polluting fuels like coal and natural gas violates a state constitutional provision. This is ABC News.
Eva's wedding.
Nana's 80th.
My first interview.
Whenever I'm on the road, I wonder, where's everyone going? Every truck, bus, car, or bike, we all share the goal of going somewhere special beyond where we're driving to. So, let's work together to make sure we all get there safely. Visit www.sharetheroadsafely.gov. Paid for by the Federal Motor Carrier Safety Administration.
Daria Albinger, ABC News.
End-of-life decisions are hard, be it pre-planning or having to navigate through the process suddenly. You need to have an advocate in your corner, which is why I wholeheartedly recommend Drennan and Ford Funeral Home and Crematory, the only locally owned funeral home in Clallam County. Their expertise ensures a smooth process so you can focus on the important things like healing and being with your family. Their help through the darkest time in my life will forever stay with me. Call 360-457-1210.
KONP News brought to you by RE/MAX Evergreen Real Estate. Outstanding agents, outstanding results. 457-6600. A 44-year-old California man who went missing on a solo hike in Olympic National Park last Wednesday self-rescued on Saturday, according to the Park Service. Hunter Frazier left his vehicle at the Deer Ridge Trailhead last Monday before embarking on a 40-mile, 2-night backpacking trek. Self-rescued via the Dosewallips River Trail with the assistance of some other hikers. Meantime, we've learned that Frazier actually missed a court appearance while he was lost on that hike. The Mercury News out of California's Bay Area reporting that Frazier was set to appear last Friday in Santa Clara County Superior Court on a felony domestic violence charge.
Here's your Newsradio KONP forecast. Mainly sunny this afternoon with highs around 74. North winds 5 to 10 miles per hour. Lows around 53. Tonight, mainly clear. Sunshine mixed with clouds at times. Tomorrow, daytime highs approaching 66. Clouds on the increase Wednesday into Thursday. Low 60s Wednesday, mid 60s by Thursday. I'm weatherology meteorologist Paul Trombley. Currently, it's 73 degrees.
It's the Todd Ortloff Show on Newsradio KONP. Now, here's Todd.
All right, welcome to the program. First half of the show today, we're going to talk about a lot of traffic stuff and a lot of road construction projects, some things that are looming, some things that are already in the works here on the North Olympic Peninsula with a couple of folks from the Washington State Department of Transportation based right here in our region as well. We welcome Ben Ford, who's the Port Angeles project engineer. Ben, thank you for coming in. It's great to have all of you, and Matt Krulish as well, who's the communications person from the Olympic region, or Mark, I should say. Mark, you here on the radio with us once in a while. So, Mark, good to have you in the studio today, not on the phone.
Good to be here. Thank you.
All right. And Ben, let's chat a bit with you. You got a lot of projects. In fact, I was looking at this list you have here. It's like something like 38 different types of projects. Is that right? Over the next year and a half, basically, going on.
Yeah, so as WashDOT, those are our projects. Not all of those projects you're looking at are out of our Port Angeles office, but we're up here doing a lot, as many of you can see going on the roads as you drive down them.
So is this a busier time than any time before? There's always projects going on, but I'm curious.
That's a good question. Yeah, it's one of the busiest times we have at WashDOT. We have the Fish Passage program, which is a big push of construction projects between now and 2030 to get out the door.
All right. Some of these are kind of mandated. They have to be done by certain times and things like that as well. I'm going to go back to last week with the mess we had in Port Angeles on Tuesday, and I'm going to use that as a reference point because coming next summer, there could be similar snafus going through Port Angeles because of a Fish Passage project. So let's start on that one first. And Ben, tell us about what's going to happen here. I mean, right in Port Angeles, You have to take care of Ennis Creek.
Yeah, so that's the North Olympic Fish Passage project we have. It won't be administered out of my office, actually, even though we're in the area. It'll be out of our Port Orchard office. It's a design-build project, so there's 5 culvert they're replacing, and they'll be starting here, I believe, late 2024 is when the first ones will kick off.
Okay, so this is going to be, and Mark, maybe I'll go over to you a bit because the communication's pretty of the essence on this one. This is going to be later in the year, not in the middle of summer then, it sounds like, when this gets started.
Yeah, generally speaking, we have a fish window in the summer where we do a lot of our in-water work. But for the rest of the project, it can be done all year round. Okay. So we can get started on the project. Then when summer rolls around, we get into the in-water work, and we can get started on all of the fish, all the culvert work we need to do.
And Mark, the reason I'm saying that is that summer around here, is kind of busy, and that's where we get it. I mean, like last week, for example, we get a lot of traffic through here. You're trying to avoid as much of that as you can.
Yeah, absolutely. You know, we always have to balance the needs of the community with the need to get the work done, and it's a hard balance to strike, certainly. But we're always looking out for that.
We should point out, too, that and that's not the only one. There's also one west of town as well. Maybe we should talk about that. But tell us about, is this going to be happening simultaneously, this Ennis Creek project, and then also the one that's out on Highway 101 just west?
Are you referring to Elwha or?
No, not the Elwha. There's another creek fish barrier project.
Lee's, Ennis, and Tumwater?
Lee's, Ennis, and Tumwater, yeah.
So those projects, I don't have the most up-to-date information on that. Those are part of the design build fish bundle, and those projects are not even designed yet at this point. We've given out to bid a set of parameters for the contractors to bid on, and we're still in the procurement phase right now of that. So here coming up shortly in about August timeframe, we'll have a lot more detail and information on those ones.
So there's a possibility some of this could be staggered out. It really just kind of depends on how the package comes back.
Right. We bundle a number of fish barrier projects together, and then the timeline is worked out. I don't know if you're familiar with another project that we call Coastal 29. There's 29 different fish jobs in that bundle. Obviously, we don't do 29 of them all at once. You know, we do 4 or 5 in a bundle, and then we move on to the next one. So once we have that bundle all figured out, we can narrow down the timelines a little better.
I mentioned deadlines of getting some of this work done. These are projects that you have to get them done within a certain amount of time, though, right?
Yeah, 2030 is the deadline for the injunction, and we have to have about, I believe it's 90% of the bundle.
Yeah, so we're mandated to get 90% of the habitat restored and opened back up. So we look at all of the habitat that's above the barriers, and so that's how we're scored against that 90% threshold. It's not we have to do a certain amount of culverts. It's the amount of habitat we're opening up through each project.
Oh, that's it. Okay, interesting. I was going with number of projects, so it's a little bit different. So it's nuanced maybe a bit more than we lay people would think.
Yeah, so you'll see right now we're getting a lot more gains in every single project we do because we're doing projects that have more habitat upstream. So we're knocking off all of those right now as we're working through this. And as we get closer to 2030, our habitat gains are going to be slightly less. So we're going to have to do more projects to see those gains come to fruition.
Ben, you mentioned this is being run out of the Port Orchard office, but let's just talk about the Ennis Creek project just because it's right in the middle of Port Angeles. How is that going to happen? Because literally there's one road in, one road out at that point. You can't just shut the whole road down. So what's the plan for when it actually starts going into keeping some semblance of traffic flow?
So for that project, the contractor is required to keep 2 lanes of traffic open in each direction for except for a period of 56 days. So there'll be 4 2-week periods where we'll allow them to shut that traffic down to 1 lane on US 101 in each direction.
Okay, so, and those familiar through there, you essentially have 4 lanes that you can work with at times. So you may see a turn lane being used as through at some point, it sounds like.
Yeah, and I want to kind of caveat the fact that we are in that design build methodology. So when we say it's going to be closed for 56 days or something like that, the way this contracting mechanism works is it allows the contractor to come up with better ideas. And so there's a potential that when this comes out, the project's awarded in 2023, that they're going to show us that they can reduce those days. So the state incentivizes the contractor to come up with solutions that provide less impact to the public.
All right. Mark, how do you get the word out to folks when, traffic will be better than not?
Yes. Well, yeah, we have a lot of tools in the toolbox. The biggest thing we encourage people to do is sign up for email alerts, and they can go to our washdot.wa.gov page to sign up for those alerts, because we send out all of our travel advisories go out through those, our news releases go out through that email list. We have our social media pages that we keep up to date as much as we can. We have a map on our app, so download the WashDOT app. Our communications team keeps up to date all of the little tabs you see on there, and so we tell you when work is coming up. So there are a lot of ways to stay connected, and we need people to stay connected because that's how this is going to go smoothly if everybody's informed.
This project actually was pushed out this was supposed to be underway right now, I think, wasn't it? If I recall, Ben, is that correct?
I have to look at Mark for that.
I believe
Mark, okay.
I believe it has been delayed a little bit. Yeah, I don't actually work on this project myself either yet. I will when it moves to the construction phase.
We'll be hearing a lot from you
Yes,
next year.
you will.
About all of that as well. Okay, let's talk about, so that's coming up. That's towards fall of next year, not this fall. This will be 24. But you do have certainly a big project out west of town that's now underway. Ben, let's talk about the Elwha Bridge replacement, because that one is running out of your office, right?
Yeah, so it is. So we, as everyone in the area has seen, if you've headed westbound out of town, that project kicked off here in the beginning of April. So we're under construction right now, and we should be keeping construction going through the end of 2024 for when the project's wrapped up to have the new bridge structure.
Now, a lot of people have looked at the timeline of this, and they say, well, how in the world do you do such a massive project and get it done in less than 2 years? Because, I mean, we've watched other bridge projects. It takes a long time to build a bridge. Is it just the methodology these days, and or just typically this project?
It's just, every project, we have engineers and contractors, and we look at it, and when we develop the schedules and put it out for bid, we have a good understanding of how long the project's going to take. So the contractors come up with their schedule. They're going to be working on a lot of the bridge foundations this year, and coming into next year, you'll see, the bridge being erected and then the other bridge taken down. And I believe it's midpoint, early summer next year that we'll actually have traffic switched over onto that new bridge structure.
All right. What's happening out there right now? Folks might see that there's been some work already underway.
Yeah, so it's all a lot of prep work we have going on right now. So I believe Mark alluded to the in-water work window. So we're only allowed to get into the stream areas at certain times of the year. So the contractors out there doing a lot of prep work. So once that fish window hits, they can just jump in full bore, and they'll be working on a couple of drilled shafts on each side of the bridge. There'll be intermediate piers kind of within the waterway. So that'll be one of the first things you'll see knocked out this year in the summertime.
And that'll be in the summer fish window then coming up at some point. Describe, folks, what it's going to look like when it's all done out there. Many people have, know it's coming, but they don't realize that it's more than just a bridge really going through there. It's a whole redesign on that curve.
So as you're coming down, let's say we're heading westbound on 101 right now, you're coming down the hill, you hit a real tight corner, and then you go over the older bridge structure. So with the new alignment, we'll be coming down, there'll be a lot gentler curve coming in, so we'll have a higher design speed, so that'll benefit traffic coming up. They'll be able to carry traffic coming up, the longing trucks, loaded down trucks. So we'll have a realignment of the roadway, which will provide benefits, and then also Olympic Hot Spring Roads, which ties in right there, will be realigned. We'll add some safety improvements. We'll have turn pockets, acceleration lanes, lighting there. There'll be transit stops on each side of the bridge structure, which there's only one on the east side currently.
Okay. Do you guys, some of this is accident data. I mean, there have been quite a few accidents down there as well. Did that play into this, in addition to the fact that the old bridge, quite frankly, is, kind of you had to do something about the pillars, right? Or its foundation was failing.
The old bridge is at its lifespan. It's a 100-year-old bridge. It's served its purpose, so it's inevitable that we get out there and do that. I'm not part of the design side, so I can't tell you what kind of safety improvements or what ideas came into it. But anytime we're doing a project like that, we're always incorporating safety improvements to it.
Exactly. I only bring it up because, and Mark, maybe I'll have you answer this. A lot of people say, well, why not just put another bridge? Wouldn't it be faster just to replace the bridge that's already there?
I would think that would take longer because you have to build a bridge before you can demolish the other one. One of the things I did actually want to mention about this project is that we're going to actually have a camera mounted out there, and I will be sharing images from it as the bridge is built. I don't have a plan for it quite yet, but every couple of months or so, I plan to share out images either on social media. We have a blog where we can kind of casually talk about what's happening with the Elwha River Bridge. It's going to be a really, really cool visual project, and I hope folks pay attention.
Well, somebody who's lived here most of my life, I'll be happy to not have to negotiate that corner going down there, because it is tough. And and I think Ben, you pointed out being able to maintain some speed going up the hill the other way. It's when you get loaded trucks coming, into Port Angeles trying to get up that hill, it's tough. It's tough for cars, not just for loaded trucks.
Yeah, that's definitely something we're always looking at ways to improvement. So the new road alignment will provide that benefit.
All right. We're going to take a break. When we come back, we'll talk a bit more about some other projects that are going on and just how this all impacts us here locally. We have a couple of folks from the local office here at WSDOT. We have Mark Krulish here. He's the Olympic Region Communications guy. And Ben Ford is the Port Angeles project engineer. And we'll chat some more with both of them right after this.
This is the Todd Ortloff Show on Newsradio KONP.
Red Carpet Car Wash in Carlsberg salutes our military veterans, active duty, and first responders each and every day. This isn't a special or a one-time deal. 365 days a year, Red Carpet offers 10% off all services to this special group. Please let them know who you are so they can honor you. And for Purple Heart recipients, you'll receive a free wash anytime, every day. Please accept our appreciation for your service and sacrifice. Red Carpet Car Wash, open Monday through Sunday, 8 till 5.
And now a word from our sponsor of the Todd Ortloff Show, Support. In addition to the fine dining experience and the bistro at Support Restaurant in downtown Port Angeles, there's the Trap Door Club. They offer the best in craft cocktails in a cozy, romantic atmosphere. At Support, fresh also means local. Support is focused on working in partnership with our local farmers, foragers, vintners, growers, and fishermen to bring you quality that can only come when it's local. If you want to join Support in this partnership, do give them a call. Contact them today. And you can also experience Support right here on the TO Show, where I will be giving away a Support gift certificate every week. Yeah, Support Underground in Port Angeles, open 7 days a week from 5 to 9 p.m. Friday night and weekend reservations are strongly recommended. Check them out now at Facebook or online, or give them a call, 360-417-6929, 417-6929.
The health and strength of a business economy can be measured by the effectiveness of its local Chamber of Commerce. Here on the North Olympic Peninsula, more than 420 business owners join the Port Angeles Chamber of Commerce to support each other and help maintain a strong and resilient network.
Your local chamber works hard every day on projects, initiatives, and advocacy to support our local economy, local business growth, and community pride. We produce events and programs that support the community, including the annual Community Awards, the Clallam Opportunity Investment Network, the Port Angeles Maritime Festival, Clallam County Job Fairs, the 4th of July Celebration and Parade, Ride the Hurricane, the Winter Ice Village, and many other programs.
If you own a business and you're not already a member of the Chamber, consider supporting the economic community that supports your business by joining the Port Angeles Chamber of Commerce.
Joining is relatively easy, inexpensive, and your membership does make a difference.
Learn more on our website, portangeles.org.
That's portangeles.org.
The Port Angeles Fine Arts Center invites you to the Summertide Solstice Art Festival. Celebrate the addition of new artwork and poetry to Webster's Wood Sculpture Park. Enjoy live music in the meadow, nature art stations, poetry readings in the courtyard, and local food and drink vendors throughout the afternoon. The Summertide Festival is free and for all ages. Join us on Saturday, June 17th from 1 to 5 p.m. at the Port Angeles Fine Arts Center. To learn more, visit our website, pafac.org.
All right, we're back with more as we talk a bit about construction, just the stuff impacted by the Washington State Department of Transportation. I was actually remarking during the break that there's also stuff happening with the cities and the counties and all of that. These guys in my studio today are not part of that. They're on the state highway work, but there's a lot of that. Just the same, we're talking with Olympic Region Communications, Mark Krulish, and also the Port Angeles project engineer for WSDOT, Ben Ford, for the next few minutes. We were just chatting during the break. Maybe I'll get both of you to talk about this. One of the things that you're really trying to do is get outreach. I mean, we're talking about a project here, for example, that's a year and a half out before you'll see any sort of an impact. This has become kind of an important part of what you're all trying to do, is to get people aware and ready.
Absolutely. During the fall of the previous year in 2022, we were already out doing outreach. We were speaking with the Olympic Peninsula Tourism Commission. We were presenting to city councils in Port Angeles and Sequim, and that was for work that was coming up the next summer. Stuff like the Hood Canal Bridge, which is happening right now. We have some fish passage projects in Jefferson County. We have a couple of safety improvement projects. So we try to get the word out as early as possible. We don't want people to be surprised. We want people to be informed. We want people to come to us with questions, because that means people are paying attention. And we don't mind that they're hard questions. We would rather you ask us those hard questions, and then we'll get you the best answer that we can. But that shows that people are tuned in.
All right. Well, then I'll ask, this isn't a hard question, but a why question, I guess. Talk about the Hood Canal Bridge. Originally there was a plan to have, full weekend shutdowns. How did that plan evolve to being, which I think is a lot more manageable for folks out here? I mean, many people would have said, well, why didn't they just go with what's happening right now with the nighttime closures to begin with?
Absolutely. So we had a few things in play. First of all, we did listen to the community. We knew that 4 weekend closures on the Olympic Peninsula was going to be very difficult for financial reasons, for tourism, for people whose livelihoods depend on basically getting over that bridge. We also had some supply chain issues with some of our parts, so that was work that we weren't going to be able to get done during the original time that we had scheduled the closures for. So we sat down, we sharpened our pencils, we looked at a plan. How can we make this less impactful? How can we do this work differently? And we came up with a plan I think has gone over pretty well. We've gotten a lot of good feedback on that.
I think most people are more than happy to give up a few overnights rather than all weekends coming up. Ben, there's another question that I think probably you all get too, is why work can't happen at night. Speaking of night closures on other projects, how do you address that?
So, the night work is a thing that there's a lot of things that can be done. There's certain items of work that we can't do at night. There's a push right now to make work zones safer. So a lot of things that we have done conventionally at night, you will see transitioning towards daytime, and that's a full effort just so all of our fellow workers can make it back home safely. That's at night times when the most dangerous activities are going on out there. That's when there's more drunk drivers out on sight distance. You can't see, everything's dark. So really moving towards daytime is a safety emphasis. So you will see more of that moving in the future.
Incentives. When you have a contracted job, can you build an incentive to get a job done? How does that work with contracting, Ben? To get a project, to get it on time or even ahead of schedule?
So we do incentives in our contracts. They'll be laid out, set ground rules. If you do this for certain items, it could be environmental things, it could be closures. But that's one thing where the delivery method. So I've mentioned, our conventional thing is where we design a project and we put it out to bid, and then the contractor just bids on that design. So when we use the design build method or even the progressive design build method that we're using now, that gives the contractor an opportunity to come up with a lot better ideas, and we put in incentive values for if you close 101 for one less fewer day, we'll give you $100,000. That's just an example, not an actual thing, but it's stuff like that we do, and that way, in the design build, we put up we kind of give them a box to work in, and that way, when they look at it, they see the box they have to work in, but they can come up with lots of better ideas than we come up with sometimes at WashDOT on our own. More smart minds can come up with a better solution sometimes.
Ben, describe for me how it works. You, as a project guy here for the Port Angeles office, what is your relationship with those contractors? I mean, how do you plug in on a project? Take us kind of briefly through how it works.
So we're partners, really. It's a marriage almost. It's not a forced marriage, but it's they bid on it and we're together through it till the end. So we always try and work with the contractors to focus on it as a partnership. We have the same goal in mind, and that's to use the taxpayers' money, put it towards the project, make sure it's all spent efficiently, and make sure everyone gets home at night safely. So there's lots of parts of how we work with them, but we all have the end goal, and that's completing the project on time and in budget.
You may get this one occasionally. Some people may say, well, why use contractors? Why doesn't the state just do its own constructions?
It goes back to our LWA question of how do we get this all done in 2 years or whatnot. Right. So there's every contractor has a specialty. So certain contractors are bidding on certain types of work, and that's their specialty. And when it comes to efficiency, you're going to want to have someone that's good at what they're doing. That way, it's efficient and you get better prices.
All right. Before we run out of time, Mark, I'll go back over for a last word from you. I guess kind of your words to our listeners as we head into this next year and a half period. What do you like people to know?
Yeah, I'll beat this drum all day long. We want people to pay attention. We want people to sign up for our alerts. We want them to follow us on social media. We want them to have our app so they can, get the latest road conditions out there. The best way to do this is for everybody to be informed. That's the way the work is going to go more smoothly. That's the way, any resultant traffic backups are going to go more smoothly, is if you have time to plan ahead and plan your trip and, do your best to help us minimize this impact.
And as I pointed out, it's not going to be just this summer. It's going to be next summer. It's going to be the next couple of years, actually, of all, some pretty impactful things happening just right here in our neck of the woods. That's just the North Olympic Peninsula, not the whole region out to the coast and all that as well. I'm sure we're going to have probably both of you in over the upcoming months to talk more about some of these projects. Mark, great to see you again. Thanks for popping in today. I appreciate that.
Thanks for having me anytime.
Mark Krulish, who's our communications guy here for the Olympic region with WSDOT. And Ben Ford, he's the project engineer out of the Port Angeles office. Ben, great to have you in. Thanks for stopping in.
Yeah, thank you.
All right. We're going to take a break, and we'll be back with more right after this.
This is the Todd Ortloff Show on News Radio KONP.
Olympic Peninsula Title is clearly your first choice for full title and escrow service. But did you know that they're huge supporters of our local community and many wonderful organizations? Olympic Peninsula Title has actively been a part of sponsoring groups such as Operation Uplift, OMC, scholarship funds for Clallam County graduates, graduation parties for Port Angeles and SQUIM, the Seroptimus Noon Club, the Boys and Girls Clubs of the Olympic Peninsula, and the Lions Club. Olympic Peninsula Title, continuing to do good things in our great community.
Building a future, sharing a dream, working together, we're on the same team.
At Straight View Credit Union, we know that buying a home is a big decision, and that's why we're committed to offering local decisions made by local decision makers. Our mortgage team is comprised of experienced professionals who are intimately familiar with the Clallam County housing market, ensuring that you get the personalized attention and expertise you deserve. We're here to help you navigate the home buying process and make the best decisions for your unique financial situation. Plus, as a member-owned cooperative, we prioritize the needs of our members and our local community over profits. That's why we're proud to offer great mortgage rates that help support our members' dreams of homeownership. Straight View Credit Union, your trusted local financial partner. Visit us online at svcu.com or stop by our branch on Lincoln Street in PA. Insured by NCUA Equal Housing Lender.
We belong to you.
Enjoy all the colors of the season with help from Airport Garden Center. Do you have a pond or water feature you need to fill with beautiful living creatures? Airport Garden Center has new fish inventory that just arrived. They now have Shubunkin's goldfish, blue channel catfish, and butterfly koi in stock. Do you have livestock tanks? Did you know adding goldfish to your livestock tanks help cut down on mosquitoes? Goldfish love eating the larvae, which help keep you and your property bite-free. Airport Garden Center also has a wide range of pond supplies to help keep your water running crystal clear and your fish happy and healthy. Come in and save on supplies for the indoors and outdoors, your four-legged animals, and even your finned friends. Plus, get world-class advice and help from the experts. Airport Garden Center, planting knowledge, growing gardeners since 1977.
For the Washington State News Network, I'm Michael McDonald. Washington Commissioner of Public Lands Hillary Franz warning about fire danger with hot, breezy conditions drying the state at a very fast clip. If you're going camping, know the fire restrictions in that area. Never leave a flame unattended. Always be careful with fireworks or incendiary devices. The Department of Natural Resources projecting above average temperatures in July and into August, which could make fire danger even more extreme. In what has been roughly a 2-year process, Camp Hope in Spokane finally shut down last Friday. Camp Hope has been open since 2021 when homeless advocates created an encampment near I-90 at Freya on property that was owned by the Washington State Department of Transportation.
This finally resolves the process that the city started to move people into better housing and to clean up the East Central neighborhood. Establishing a date for closure was critical for those staying in the encampment, the neighbors who live around it, and the businesses and employees who work around the camp.
Spokane Mayor Nadine Woodward. At its peak, about 700 people lived at Camp Hope. And a missing hiker in the Olympic National Park self-rescued over the weekend. 44-year-old Hunter Frazier from California, an experienced hiker. He was reported overdue on Wednesday. He was located by other hikers who helped him out. For details on these stories and others, download the WSNN mobile app or visit WashingtonStateNews.net.
The possibility of lung cancer can be pretty scary, especially if you're one of approximately 8 million current or former smokers at high risk. That's why SaveByTheScan.org wants you to know that now there's a breakthrough low-dose CT scan that can detect lung cancer early, and it only takes 60 seconds. You stop smoking, now start screening. For an easy quiz to see if you're eligible, visit SaveByTheScan.org. It could save your life. SaveByTheScan.org is brought to you by the American Lung Association's Lung Force Initiative and the Ad Council.
I taught for 20 years, until I started forgetting my lectures.
Eventually, he had to quit. Getting his early Alzheimer's diagnosis was hard, but it gave us time to take control of the situation, together.
I can't imagine going through this without him.
If you or your family are noticing changes, it could be Alzheimer's. Talk about seeing a doctor together. For more information, visit alz.org/time to talk. A message from the Alzheimer's Association and the Ad Council.
Here's your News Radio KONP forecast. Mainly sunny this afternoon with highs around 74. North winds 5 to 10 miles per hour. Lows around 53. Tonight, mainly clear. Sunshine mixed with clouds at times. Tomorrow, daytime highs approaching 66. Clouds on the increase Wednesday into Thursday. Low 60s Wednesday, mid 60s by Thursday. I'm weatherology meteorologist Paul Trombley. Currently, it's 73 degrees.
In our next segment, we're going to talk about Volunteer Hospice of Clallam County. You've probably heard lots of PSAs. You've probably seen lots of things that they're involved with, but you may not know exactly what hospice is when we talk about hospice. So we're going to spend some time chatting about this organization in particular with the relatively new executive director for hospice here in Clallam County, the Volunteer Hospice, and that is Priya Jayadev, who I've had on in the past for Mosaic. It's kind of a switch in things. But welcome back. Good to have you back, Priya.
Thanks.
It's
good to be here.
Great to have you here. And along with Priya is Marka Davies, who's been is the patient care coordinator, been with hospice for a long time. I'll just leave it at that. And Marka, good to have you as well.
Thank you.
Priya, let's chat with you first. Just kind of define for us what volunteer hospice is. People hear about it. You know, what's the model? How does it work here in Clallam County?
So Volunteer Hospice was created in 1978 by Rose Crum, who was a visionary RN who was in our community. And remember that hospice as a concept reemerged in the U.S. in 1974. So 4 years in, a nurse in our community had the vision to create a hospice here in Clallam County, right? That's pretty impressive. When she created it, she had a vision of creating an independent organization. And at that time, there was no real insurance coverage of the hospice benefit, right? That didn't exist. It wasn't until the 1980s that the hospice benefit came into play with Medicare paying for hospice. But Rose was adamant and very, very straightforward in that she wanted to be able to serve more than just what the benefit limited. So she activated her son, Patrick Crum, and Derek Kilmer, who was in the state legislature at the time, and got a carved out RCW for just us. So we have an RCW to operate as a hospice. We had to put volunteer in front of our name, and we do have a large volunteer pool, but we have professional skilled nursing and skilled certified nursing assistants. But because that exception exists, we don't bill Medicare, Medicaid, or any private insurance. We do all our stuff for free through community support. And we don't have the limits of 6 months or less to live. I mean, you have to have a terminal diagnosis, but we also allow patients to come on for palliative as well as hospice care. We don't take over a patient's care. We provide care in conjunction with the existing medical staff, so we come alongside, and we allow patients to continue curative treatments if they wish. So,
It amazes me, though, when we talk about this model, it's for free. I mean, if I need your services, you will come and take care of me and my family for free.
Yes.
People will say, how in the world do you do that? Because there's a lot of services you're providing.
We're very lucky in that this community has been super generous in supporting us through the years. I mean, there's always ups and downs. We're in a good place right now, and we continue to get that support, and we hope that will continue so that we can be sustainable in perpetuity. But this community supports us. They give us donations of medical equipment, which we take and we give back to the community. They give us support through dollars, and we take that and give back to the community as care. Right?
It's amazing. I don't know if this is the case, but do you sometimes get, bequeath money from people that you've taken care of?
Yeah, we do. We've been very fortunate. There's been bequests that allow us to have a little bit of a cushion in that year to year. Right now, my budget is $1.7 million, right? And I don't raise that every year. I would love to so that we could be here forever, but I don't raise that every year. So we have some bequests that have come in the past that we have kept in reserve to cover that gap.
It's amazing, though, because if you, like you said, all these years you have been here, though, which is just really think about it in the world of medicine and anything else these
and it's
days.
All support from Clallam County. Yeah. It's all Clallam County-based support.
Marka, you've been involved a long time with this, and one of the things we talk about if we went on the air is people probably don't understand what hospice really is, and I think Priya pointed out that if you do just the true, Medicare, Medicaid benefit that's there, it's like a really true end-of-life thing. But hospice in how you all administer it for your patients can be years in some cases.
Yes, we have a patient that's been on our service since 2012.
Oh my, okay.
And that's not, it's not really common, but we'll have patients on for years where when they finally do approach the end of their life, the family will say, well, you helped me keep them going. And it's because we didn't cut them off on what they were doing, but we just supported the family.
When somebody comes to you, Mark, and they say, I've been told that we need to prepare for hospice care. What does that mean? When that word comes to a family, describe that for us.
Usually for a family, it's they've decided not to seek aggressive medical treatment and multiple visits to the emergency room and multiple hospitalizations. We don't say, no, you can't go to the emergency room, because we don't stop that. But we try to help people keep comfortable at home. Yeah. So they can stay at home and have comfort and not be aggressive in their treatments, to not be in pain, to have their needs met, to just be supportive of their family so they can spend quality time in their home.
So describe for us how, you determine level of service, what that looks like. I suppose every case is somewhat individual. That's part of what you need to take a look at when someone comes in.
In particular, with our patients, we try to follow what they want.
Yep.
So we don't make the goals for them. They tell us what their goals are, and we try to support them in that. So we get a referral from a physician that's required. The families have to have adequate caregiving in their home because we're not caregivers. We're not going in there and doing we do physical care on patients when we visit them there, but we are not in the home 24 hours a day. We're intermittent. So those are some requirements, but we help them whatever their goal is.
And I think there's important differentiation there between 24-hour care. At some point, you're there more often than not, though, right?
Yes, that's true. When we first see a patient that we would call palliative, that means they're not imminently dying or they're not dying in a short period of time. We initially see them, do an assessment, and then shortly thereafter kind of follow up with that to make sure their questions got answered, et cetera. And then we only see them maybe once a month, call or check in once a month. As things progress, we might see people every day and sometimes more than once a day if they need that.
And you also are there as a help to the family through a process, right? Yeah.
Yeah, we're teaching families how to care for their loved ones. It's we're nurses, so we know how to take care of people.
Right.
They've never turned a patient in a bed, or taken care of someone that couldn't get out of their bed. And so we teach them how to do those things.
And also, quite frankly, say this is the process that their loved one is going
exactly.
through. You're going to see this, and you're going to see this.
Yeah, we
and
will
this
talk about
right.
those transitions. you know, because it's a fearful thing for some people that they don't understand how the breathing pattern changes are. Now they don't have an appetite. Do I have to keep feeding them? So we'll talk about all the natural changes that people go through at the end of life.
You know, Priya, you mentioned that this is a job where everybody you work with is an angel.
Yes.
And I'm noted that in all my years, all I've heard are people who, and probably some people who are reluctantly, you know, told you need your services. But when all was said and done, everybody has said this is the best thing ever.
Yes. Yes.
It's just, it's
It
amazing.
is. And just to add to, I mean, in terms of the family support, there's also respite volunteers that we have that come in and give families relief so that they can go and run an errand and those kind of things. So Angel, not just in the care piece of the patient, but also care of the family. And then even after the patient has passed, there is that opportunity to care for the family through grief and bereavement support services and support groups, one-on-one support, regular check-ins, all of that is available as well.
Even anticipatory grief. Yeah. Some families, you know, they have more of a struggle with the death process, and so we have a wonderful volunteer services manager who has this whole slew of people that are very skilled in grief support, and she'll have some people get the help they need before the dying has happened.
And probably they're a little bit cognizant, I guess, as to I think this family's going to need a bit more or something different or a certain approach.
Yes.
Yeah. The hospice, you know, in the history of hospice, I think it's interesting when you heard 1974 kicked around. Most people thought, well, wait a minute, we've only had that really recognized in the United States since then. Tell us about the history of hospice.
So the hospice concept was existent in the Middle Ages.
Right.
Yeah. So it was there. But it kind of, as medical science progressed and improved and increased, the idea was let's save lives, and the concept of death became one of failure, as opposed to the hospice concept of this is natural transition. So in that natural transition process, the hospice got re-embraced in the European countries in the 50s and 60s, came back into the U.S. culture in 1974. So it was kind of a reemergence from past times, more so than a birth of a concept.
Very good. Mark, quite frankly, I mean, not to be glib about it, everybody's going to die. So, I mean, it's kind of surprising that we weren't fully embracing a hospice concept forever.
Yeah, I guess in our society, we don't like to think we are going to die.
And how tough is that, I guess, as a nurse and trying to provide hospice services? I mean, is that a barrier you kind of have to work through? Or how to?
I wouldn't call it a barrier, but it's something we might have to give someone more support in.
Yeah.
You know, and for most people, they begin to recognize the value of letting the really technical stuff go. You know, they want to be in their home. They want to be looking at their view of the water or the mountains, or to be able to have as many people, especially since the pandemic when it was so limited who could see you. Now they can be in their home and have everybody in their family come and visit them if they want.
Right. That's important. I mean, that's a whole sociological thing. And I'll go back to you pointing out sometimes that gives people some hope to carry on a bit longer,
It
too.
does.
Because they're not isolated and they're not feeling like, what's the point? Right.
And they find out they can be comfortable, more comfortable at home.
Yeah.
There's actually data to that point that people who oftentimes go into hospice care end up living longer than expected, simply because the care and that comfort and pain relief allow them to be in a different place than prior to.
How do you make, Mark, when you consult a family when they first get that, you don't want to give false hope in some ways, but, do you talk a bit about, because I think it's kind of a scary word, hospice. That's the end.
It is. Actually, we talk about it. I talk about it a lot when I get the initial referral on a patient and they're reluctant. Then I always tell them the story about the people who we've had on service for a long time because we made their life a little bit easier without giving false hope.
As far as treatment goes in administering things, as nurses, you work with doctors? How does this happen? If you've got somebody in hospice care, but maybe they still are taking some medications and things. I mean, how does that play in?
Well, we often have, not every patient, but all of our patients still have their medical provider, be it a nurse practitioner, a PA, or a physician. And so we're primarily dealing with the end of life things. but we support them in the other things. So the family might call the physician to get a re-up of a medication that's related to their cancer treatment or their hypertension, but we'll reorder things that are for their pure comfort.
Got it. All
Through
right.
the physician. So we're in constant communication.
So yeah, you may consult with the physician, say, hey, we think this might make this person a lot more comfortable. I mean, they may need something that they haven't been prescribed before.
And they'll ask us for our advice on a situation, and because we're kind of the eyes and the ears in the home, they'll listen to what we have to say about it.
All right, so Priya, the volunteer, as you mentioned, had to be at the first of your name, and that also is what drives this whole thing. All your folks are volunteers, basically, that are. But so tell me how that works.
So we have 21 staff members.
Okay.
We have about 16 or 17 nurses, skilled nurses, paid staff. We have 2 certified nursing assistants, and we have 5 people on the mission support team helping. And one of those, as Marco was talking about, is Astrid, our volunteer services manager. Astrid manages a cohort of 165 active volunteers, 165 monthly active.
So those folks, what do they do for your organization then?
Oh, okay. So they run our front desk. So they're our administrative staff. They run our lending closet, which is another piece of our services we haven't talked about. We have delivery of medical equipment. They do all of the delivery work. They do respite support. They do grief support. They run grief support groups. They run groups on how to survive the death of your loved one, all kinds of things out there. All of those things are volunteer run.
Right. So suffice to say, a lot of the organizations on the back of volunteers, which allows you then to have the staff, pay for the staff to do the quote-unquote actual hospice work, I guess, if you want to call it that.
Well, to correct you, the volunteers do the actual hospice work too.
True. Yeah, I suppose.
I mean, we couldn't get by without them.
Right. Yeah. Right. So, let's talk about the lending closet, because that's an important thing. I've got an elderly father, and they've taken advantage of this. He's needed a walker. He's needed an adjustment on a cane once in a while. I mean, it's a tremendous service.
Yes.
Tell us about that.
So we have all kinds of durable medical equipment, from hospital beds to wheelchairs and walkers and bedside commodes and overbed tables, all of that. For patients on service, we also have some disposables as well that is available for them to take advantage of. And when we do hospital beds, we'll deliver with linens, all of it. And that's all available for free to anyone.
And that was okay. You don't have to be a referred hospice patient to take advantage of that. What about that lending closet, if you will? And it's a lot more than a closet. You've actually had to move your headquarters to make room for it a few years ago. But what got that started?
I don't know.
Probably,
I suspect Rose saw a need.
Yeah, most likely,
because she was pretty magic about figuring out a way to meet the need.
Because, quite frankly, in a lot of cases, it's kind of a temporary thing. And folks, it's like, I need this, but I only need it for X amount of days or whatever. And, and I can't get my hands on it.
And we take donations, and if it's appropriate, we will clean it and redistribute it. We will take in just as much as we will give out. If it's not appropriate for us, we'll refer to where it might be better to send a donation. And then if we don't have a donation, there are other organizations, service organizations locally, as well as in Paulsville.
Knights
that
of Columbus.
have some heavier duty equipment, let's just say, available.
So is there any other volunteer hospice like this running right now in our state at least?
We believe we know of 5 in the nation.
Yeah, okay.
We believe we are the only ones in the state that operate as we do, where there's no billing and all services free. Yeah.
I suspect there's a reason for that, in that you have been supported generously, and it's a risky proposition if you were to launch this and not really have, and some places may not have the type of financial backing from a community, for example.
It's tough, right? But here's the thing. If you look at what Medicare will fund a single patient on hospice care, the cost of care is about $33,000 or $31,000, somewhere in there, per patient. Per year. And if you look at our bottom line expense and divide by the number of patients we served last year, our cost per patient is about $5,000. Wow. $5,000 to $7,000 per patient. So it's a cost savings in that sense. In addition, the Medicare dollars that are not spent for our services can be spent on all the partner services. OT, PT, home health, medications, the physician, all of it, cancer care, all of it. So they're reserving the dollars, the patient is reserving those dollars for the other care partners, and we come in and do everything for free, right? So it's, in that concept, it's not easy to start that without some backing because we can't support our budget without backing from this community, and it's hard to start that.
And we've had a generous community.
We have.
And we'll just have to go back to the original angel in Rose Crum, who had this vision to set this thing up in 1978, right?
Her force of personality carried it through some of the leanest years, and she mobilized people like nobody's business. She's amazing.
Yeah, and fortunately for us, she was here.
Yes.
Unfortunately for other communities, they didn't have a Rose Crum to kind of start this, and I think that's what we're playing out.
Several times in the last couple of years, we've met with people from other communities. Like we met with some people from Montana that wanted to start one. We met with some people from Pennsylvania that wanted to start one, and they came and sought us out to learn how we pulled it off.
Yeah.
Did you say, well, first you got to find one person that's going to
find Rose.
Rose.
Yes, you need that.
That's great.
Yeah.
As we kind of wrap things up, Mark, I'll go to you and talk about this. You kind of pulled you out of retirement twice, it sounds like, almost, to do this.
Well, so by choice.
Right, and that was my question. Describe for me what you get out of doing this work.
I feel like I've been a nurse 50 years, and this is the best, even though I loved my long-term career of being a nursing faculty. I love feeling like we're doing something for someone. We make a difference. And that's a good feeling, and it's nice to be useful at this point in my life and be able to still fulfill the mission of my career. Nursing's never just been a job to me. It's been a vocation, a way of life. And I'm very fortunate that I can do this, the best nursing care I've ever done.
I think we're fortunate that you've decided to continue to keep doing it here,
yes,
too.
She won't let me go. No, she's not allowed to retire ever.
All right, so Priya, maybe not a fair question because since you just got on as the executive director, but kind of the same thing. I mean, what are you getting out of this now? Because this is a new adventure for you as career-wise.
Well, so my career was from a biological science background, so it's kind of nice to get back to that clinical science-y piece. So there's that. And then the second piece I think I mentioned to you, I have never been in a job before where I literally go in and I see case note after case note where people say, you are living angels. I get to work with living angels. What can I say? There's no better job.
All right. People, we got a website. If people want more info, what should they do?
Volunteerhospice.org.
Right. It's a great organization if you're looking to volunteer at. As we just pointed, you can always use more. I know every month have a little session in SQUIM and PA to get people up to speed on how they can help out. And so be listening for that as well. We will certainly have you back soon.
Thank you.
It's great to see you again, Priya Jayadev, who's, when did you start? Last year? September last year. All right. Well, I waited too long to get you on, so. And Marka Davies, it's great to see you. Thanks for all the work you're doing there as well. Appreciate that. We're going to take a break, and ABC News is coming up next.
Red Carpet Car Wash in Carlsberg salutes our military veterans, active duty, and first responders each and every day. This isn't a special or a one-time deal. 365 days a year, Red Carpet offers 10% off all services to this special group. Please let them know who you are so they can honor you. And for Purple Heart recipients, you'll receive a free wash anytime, every day. Please accept our appreciation for your service and sacrifice. Red Carpet Car Wash, open Monday through Sunday, 8 till 5.
Tickets are now on sale for Petals and Pathways Home Garden Tour in SQUIM. Sponsored by the Master Gardener Foundation of Clallam County. June 24th, 10 a.m. till 4 p.m. The self-guided tour tickets can be purchased in SQUIM at Over the Fence, the Co-op Farm and Garden Store, and Sunny Farms. In Port Angeles at Port Book and News, Swain's General Store, and Airport Garden Center. Early bird tickets are $15 and day of the sale are $20. The annual Petals and Pathways Home Garden Tour, June 24th.
When everyone has opportunities to succeed, our community is stronger.
By supporting United Way of Clallam County, you help make this possible.
We are committed to improving the health
health, education, and financial stability of every person in our community.
With our partners, donors, and advocates, we reach more people to make a bigger difference in Clallam County.
We are here for you.
And we are here because of you.
Together we can recover, rebuild, and reimagine.
To learn about how we can help everyone have access to the resources and support to make this happen, go to www.unitedwayclallam.org.
I was scared the night you overdosed, but I was prepared. I brought naloxone with me, and I knew how to use it. I held your hand tight when you woke up because I wanted you to feel safe. Your life is worth saving, friend, and I would save it again if I had to.
Naloxone can reverse an opioid or fentanyl overdose. Carry it with you. For more info, go to preventoverdoseva.org. A message from the Washington State Department of Health.
News, sports, and information for the North Olympic Peninsula.